Dr. Gruber, I accept your apology. I'm not going to question you further. Your statements invite acts of demagoguery. You will hear enough of those. I decline to participate. Ms. Travner, the 400,000 difference is trumpeted as if it were worth hiding so small an amount when the Affordable Health Care Act greatly exceeded our expectations in the numbers that would sign up. So that all I can say is if the administration was going to fudge it, I certainly hope they would not have been so amateurish. And I think the American people will understand how one could confuse people who signed up for dental care. You're just looking at people who signed up and people who signed up, period. Because those were not the distinctions we were looking for at the time. Mr. Goldman, you are a constituent of mine. I appreciate that you stepped forward. I do want to say to you, the chairman said something about cost sharing in his preface to questioning you, but you had testified that you were not being subsidized.
That's correct.
If that is the case, you are like millions of other young people who got lower cost insurance simply because you're young and not because any cost was shifted to you. That is the very nature of insurance. Now, I'd like to ask, I note, Ms. Tavner, that this hearing is taking place when we are early in the new enrollment system, enrollment period, I'm sorry. And I thank you for coming at such a busy time. You had a deputy, the principal deputy administrator, I'm sorry, not your deputy, but the principal deputy administrator, is quoted as saying the vast majority of shoppers had a positive experience with healthcare gov. Is that your understanding? If so, that needs to be out here, given the faux pas of the first few months.
Yes, ma'am. Our second enrollment period has been much smoother, obviously, but we have been able to talk with some consumers. We've also been able to meet weekly with issuers to ask them what they're seeing from a consumer perspective as well. And so far, the enrollment process has been easy by folks' terms. I'm sure it's not perfect. We still have room for improvement.
Are you doing the kinds of customer that you can quantify customer experience, so that you can quantify as to what the experience has been, so you'll be able to say that at the end of this period?
We are. It's a little early because obviously we're just 3 weeks in, but we are doing surveys both through the call center and surveys through healthcare.
That'll be very important because you had such a poor start.
Share that information.
Now, understand that you can now handle a 250,000 concurrent users. Is that the case?
Yes, in our testing, that is what we aspired to, and we were able to do end-to-end testing to handle that type of volume, yes.
I have some numbers here that open enrollment in 2014, more than 1.5 million Americans submitted applications for coverage, and that 765,135 individuals selected a plan. How does that compare, if you have any figures, with the first few weeks of open enrollment in 2013?
Well, as you might remember, in the first few weeks, we were dealing with a website that was far from ideal, so our numbers were very low. We are pleased with the numbers in the first 3 weeks, but I think we know by 1 year's experience that individuals will wait until deadlines to sign up, so we are looking for...
And what is that deadline, Ms. Tabb?
So the first deadline is December 15th, so this coming weekend we think will be a high volume. And then again, February 15th, when open enrollment closes for 2015.
I would like, in light of how easy it is to make errors that you will then be called on, in September, you testified before this committee, and you pledged to address, at that time, 22 technical recommendations that the GAO had made to improve the security of the website, and that is always a concern. Were these 22 recommendations addressed before the beginning of open enrollment this year?
Yes, they were. We completed our work on all 22 of those recommendations. And then there were 6 other categories, and we've completed the work in that area. Probably the only thing that is not totally complete is the operating agreement with the with OPM and with the Peace Corps. We have a contractual agreement, but we were going through a full contracting process, and that's underway.
So as of now, no one can...
I think the gentlelady's time has expired.